Ignatia and Natrum Mur are two of the topmost remedies that we first think of when treating deep or prolonged grief. And the psychodynamics of both of them are pretty similar. That is, their complaints originate in their childhood when they feel unloved. And this can even be an unconscious reaction. That is, they might not know that this is where their complaints begin, or the patient may not himself have found this out, that there was any such feeling of being unloved. But the same grief is triggered each time in life when he feels unloved, whether it be through death of a loved one or through rejection. And in Natrum Mur, the reaction is more controlled. That is, a Natrum Mur would not let people around him know that he is grieving. It will be more of a silent reaction. But Ignatia loses all control, at least initially. There is hysterical crying, sobbing, which could be followed by weeks of mood swings, alternate anger, weeping, wanting to be alone, crying when alone. And they're both similar in this aspect of avoiding company and wanting to be alone, because having once experienced abandonment, they don't want the company of someone, the comfort of someone's company, which they could lose again. So they don't mix up very well very soon after they've experienced grief, and they need their time to again wanting to be with people. And Ignatia can even be an acute stage for any other remedy. Like, it might not necessarily be a constitutional Ignatia, but any remedy can have this Ignatia stage when they've experienced death of a loved one, and all of these symptoms are visible: mood swings, hysterical crying, or even physical symptoms of nausea, feeling some emptiness in the abdomen, a lump sensation in the throat. So all the symptoms of acute grief, of active stage grief. If someone is experienced recent loss of a loved one and is experiencing such a state, Ignatia can be useful even for them, even if it is not a constitutional Ignatia. And when it has become more of a chronic thing, when it has settled, when the acute stage is settled and it has taken a backseat, Natrum Mur can help then. So Ignatia is more for the active stage of grief, and Natrum is once it has settled. The hysterical symptoms of Ignatia can even involve the nervous system. So there can be symptoms of epilepsy, numbness, or insomnia is very common after loss of a loved one. In an acute stage, if anything of that sort is also visible, any of those complaints, then also Ignatia may be very helpful.